Happy Friday, everyone. Today marks the 6th week since Alabama reported the first positive COVID case in Alabama. So we're all hanging in there for the long haul. We know that this is not going to be a sprint, but a marathon for the pandemic COVID response. So I'm Rendi Murphree, epidemiologist and director of disease surveillance and environmental services at the Mobile County Health Department. We're here to give you our 2:30 update. Worldwide, we have 2.7 million confirmed cases of COVID-19 disease, with topping 192,000 deaths. For Alabama, 169,000 plus confirmed COVID-19 cases, with almost 45,000 deaths. And in Alabama this morning, the live data dashboard was reporting on 5,832 COVID-19 cases in Alabama, with 197 COVID deaths. And you will see on that live dashboard, they have gone as promised to reporting just one number for deaths, and those are COVID-19 deaths. For Mobile County this morning, the dashboard was showing 810 confirmed cases, with a steady number of deaths at 38 for Mobile County. There was, again, last night in Montgomery, some trouble with the reporting servers, the file servers, the databases that provide information to us. So I'm not sure that the dashboard has been updating live throughout the day. And if it has not, that's why. They're trying to rebuild that and stabilize it and put together some safety nets so that we can have the most accurate and timely information that we can get. So be patient with us and with ADPH in Montgomery as those IT professionals work out some of those kinks. As you can imagine, this is an unprecedented time in our state's ability, our world's unprecedented for our world, for that matter, and it's not a surprise that we're trying to keep up best we can. I just want to read this note that our public information officer put in our daily dashboard, which I think gives us some context. So ABC News stated that China reported no new deaths from novel coronavirus for the 9th consecutive day on Friday today. So I think that, we first looked to China when the pandemic began. At the time, we didn't know it was going to be a pandemic, but that was a year ago. And now China has seen a steady decline in the number of cases, and now for 9 days consecutive, no reported COVID deaths. So that's good news, and perhaps provides some context as to how long we might be dealing with pandemic COVID-19 in Mobile County. All right, so I won't be able to give you any details on our cases today since I wasn't able to run our daily report, but I will get to some Facebook questions and some media questions before we head into our weekend. So please tell us about pets getting the virus. I heard there were 2 cats that tested positive. Yes, the Centers for Disease Control published a report, I think yesterday or today, about 2 household pets. These 2 cats that tested positive, I believe one of them was living in a household with a COVID positive human, and the other one was not. And the message is, we will continue to learn about the vulnerability of animals being infected by their owners or potentially by other animals. So social distancing will work for animals too. So if you have someone in your household who has tested positive for laboratory COVID, or who is sick with a cough or fever or shortness of breath, please physically distance from your pets and keep sick individuals away from your pets. If you have a pet that is exhibiting signs of respiratory disease, you can contact your vet and safely get them into the vet to be examined. All right, can we get some testing up in Centronelle? Is it Centronelle or Centronella?
Nell.
Centronelle, okay. You can tell that I just moved back to this area about a year ago. We are seeing some expansion of testing. I don't know about specifically for Centronelle. We are continuing to hear about the Walmart in Saraland that should begin providing drive-through testing as early as next Thursday or Friday. So keep an eye open for that. As we've been providing, if you can safely get to our downtown Keeler location, we have drive-through testing here for anyone who meets the criteria. And again, if you have a persistent illness that is not resolving, that qualifies for testing. So you can call 410-6243, that's 251-410-MCHD, or 6243, to make an appointment to get a COVID test at our downtown location at 251 North Bayou. But I just want to remind everyone, if you're sick, we really want you to stay at home to the greatest extent possible, except to seek health care or to buy groceries or to purchase non-essential items. And if you can send a family member that is well out in the public, then that's what we prefer, and always with a face covering. Okay, if a person tests positive for COVID and recovered, or if they didn't know they had the virus and recovered, will the test results, if tested again in the future, always show positive? So it depends on what test you use. If you have virus circulating in your respiratory system and you get a swab, if that swab is positive, it's testing for the presence of virus in your nose or in your mouth or in your airway. When you are no longer sick and when you have eliminated the virus, eliminated the infection from your body, those tests will no longer be positive, right? So you will clear the infection, and that test, that PCR test or that test for the virus will no longer be positive. There's a little bit of caveat in there because sometimes the test can detect virus particles that aren't necessarily alive. But an antibody test, which is designed to detect the immune cells that are produced to an infection, they could persist much longer than live virus. So if a week or 2 weeks or a month or 2 months or a year or 2 years after your infection, you could potentially still test positive by an antibody test that would indicate that you had been infected sometime previously in your life. All right. So what is the turnaround time for tests now? The good news about the turnaround time for tests is that most laboratories, once they have the specimen in their laboratory, they can turn that test result around within 24 to 48 hours. But it depends on them having the specimen in their lab. We know that there are sometimes delays. We have a lab in Mobile that is here, and providers can take specimens in the morning and they're at the lab in the afternoon. If you get testing by our state public health lab, if you get your specimen to us by 2 o'clock, we can get it to the BCL lab the same day. And depending on the volume of tests they have to run that day, it may have to wait till the following day to get tested. So the shipping time or the delivery time of the specimen from the time of collection to the time it gets into the laboratory also impacts what the turnaround time for tests are. But we're starting to see them come within just a couple of days, a day or two, if it's run in Mobile. Do you give nursing home information to families of residents? I do not give nursing home information to families of residents, but all of our long-term care facilities that have COVID positive residents or staff are in close communication with the families of their residents, and they are providing information to those residents who have tested positive. So that is the responsibility of the individual health facility. Just like a hospital would provide results to their patients, the nursing homes and assisted living facilities are providing information to their patients and to those family members who are authorized to receive health information about them. All right, here's someone that says they're wondering if face shields work as well or better as masks for general use. So I've been wondering if a handkerchief, I wear a handkerchief when I go in the store, but it's really hot, and I was thinking a face shield would be more comfortable. So here's the deal. The mask and the face shield serve two separate purposes. The mask is to protect your nose and mouth, right? Anything coming out of your nose and mouth, this is to keep it from getting out into the environment. What you're talking about with protecting from other people is a mask to protect you from illness from other people, right? That can only be accomplished with an N95 or higher respirator that someone has been fit tested to wear. And then the face shield protects that person's eyes from any of those aerosolized virus droplets getting into their eyes. So the mask and the shield, the N95 mask and the face shield, those are recommendations for healthcare providers who are working in areas where there is known COVID-19 transmission. And the face shield protects virus virus respiratory droplets from getting into their eyes, and then the N95 protects the respiratory droplets with virus from getting into their nose and mouth. So those are very two different reasons for wearing the mask and the face shield. All right. There's a question here about if it's from so if the coronavirus comes from an animal, why is it just in the fall? Can't the virus come any time of the year? So I think there's maybe a little bit of mixing of, folklore here. So the seasonal influenza, the viruses that circulate around the world each year and arrive here in the fall, those are seasonal respiratory viruses that we know circulate usually between October and April, right? Most of those strains are very well known to us. We develop vaccines on them. We have antivirals to protect against some of them for the influenza strains. For some of the other respiratory viruses that circulate from the fall to spring, like enterovirus, parainfluenza, rhinovirus, those types of things, we don't have good vaccines for, but that's the seasonal influenza, fall to spring. The novel coronavirus and any other novel viruses, yes, if they're coming from animals to humans, that can happen almost any time. So I hope that helps on that question. Do you have any from there, Mark, that you want me to? I got a couple more pages here, folks, so just hunker down.
Oh. Sorry, Klaus. Nursing homes have always been said to be at risk of coronavirus. How serious is the problem that the Alabama National Guard has had to step up to clean? And have we reached a point of no return now that the Alabama National Guard is having to disinfect a local nursing home?
So let me clarify a little bit. Yes, we have clusters of coronavirus infection in several of our nursing homes. Those nursing homes are following all of the CDC precautions and guidelines for testing, for staffing, for personal protective equipment, for quarantine, for isolation, and for disinfectant. It's not like they've been just waiting for the guard to get here to start disinfecting. Many of them, in addition to their normal disinfection procedures, have also contracted with commercial companies that provide disinfection, and they are using those in their facilities to try to make sure that they have that second added layer of disinfection. And then when the governor says, hey, I'm activating the guard and I'm going to make them available for disinfection, when the guard calls, you don't say no. So some of the facilities that are getting, well, all the facilities that are getting disinfection from the National Guard have already been using their regular level of disinfection according to CDC protocol. Most of them a second level of disinfection using contractors that specialize in this. And then when the guard calls them to say, hey, we have time, would you like for us to disinfect? They say, yes, please come on in. So it is not an indication that we are having, an extraordinarily difficult time disinfecting our long-term care facilities. It's just an added layer of protection so that we can try to stamp out coronavirus infection in these facilities. Anything else, Mark?
No,
okay. So here are some questions. With respect to infections and deaths involving COVID at long-term care facilities, why can't the health department identify the facilities? Understand not identifying individuals, but it seems like the public has the right to know. So if it's a statutory requirement, can you point to the specific language? So I do not have, my authority is over cases that are reported to us. So I can collect and report on cases that are reported to public health. Yes, outbreaks are also reportable to the state health department and to the Mobile County Health Department. So they must report to us. But we have a responsibility to allow them to provide any public information that they feel is important to release. It's not our story to tell. I can tell you in aggregate how many facilities we have cluster investigations on, about how many have been, of long-term care facilities have been associated with illness and deaths, but it's their story to tell from their particular agency or facility leadership, and I don't even really have all of the information that I would need to accurately tell their story. All right, with reports that the coronavirus dies quickly in sunlight, is health department recommended people spend more time outside. So this is also a little bit of folklore. So with UV light, some different UV light rays, it can kill coronavirus. So in healthcare settings and in air handlers, there have been some attempts to add UV light to those areas to kill viruses and bacteria that might be on surfaces or in the air. But that's not the kind of sunlight, the UV light that we get just out there from the sun. The part of what, it can't hurt, but part of what helps when you're outside is that your air is circulating around you in much more than it is if you're indoors and in a confined space. So that's why we advise if you're outside and walking and in the sunshine, keep 6 feet apart, but please carry on those duties. But it's really because inside we don't have the same fresh air and air exchanges and that sort of thing that we really worry about congregate setting. And two, outside you're able to socially distance more. If you're in a building and you need to get on the elevator, you have no options but to get on the elevator and be too close from people. But if you're in a park or on a trail, you have much more opportunity to distance yourself. What's the health department's role in reopening the city? Not officially announced yet, but the mayor has said he's expecting to lift the curfew. So we are in daily communication with the city of Mobile, with the county commission, with several other city mayors in the county, and we all have our individual perspectives on what it means and what it would take to lift public health restrictions around our community with good information. So the health department continues to prioritize health, and we will always prioritize health when making this decision. The mayor, the county commissioners, the governor, businesses, restaurants, they all have their own perspectives and their own motivations for wanting to make decisions. But we will be involved in those conversations, and we will continue to prioritize health. I think that, I hope that soon we will see something out of our governor's office and our state health officer, because most of the restrictions that are in place now were ordered by them, not by our health officer. So more to come over the next couple of days and into next week. I know everybody wants to know what's going to happen on May 1st, but right now I have no insider information about if there's going to be an extension of an order, a new order, the lifting of orders. I have no idea. We are waiting to hear from our leaders in Montgomery, just like you are. Let's see, someone asking again about recent deaths for COVID. Again, there's been a slight change in the way COVID deaths are classified to make it happen more timely, so that if someone has a positive COVID laboratory test and then they die, they will be counted as died from COVID illness. The ones that we will hear about more slowly are the ones that were not diagnosed with a positive laboratory test before death, because those deaths have to be investigated after the fact, and that is going to require certification of a death certificate as having died with COVID-19, and that process takes a little bit longer. Part of the reason that we have an increased death in Mobile County is because we have outbreaks in a couple of nursing homes, and they have contributed to the deaths. Probably around 1/3 of our reported deaths have been residents of long-term care facilities. Long-term care facilities are required to report cases to the health department just like any other healthcare provider. So they are required to report positive laboratory tests. And Rendi Murphree and the health department, I'm not aware of any layoffs at Mobile County hospitals. Please contact them directly with that inquiry. So here's a question that one of our news partners receives calls daily from family members who want answers about their loved ones in long-term care. They hear about positive COVID cases and are trying to get it confirmed, worried about health and safety of their loved ones. I understand that this is a grave concern of families who have loved ones that are in long-term care facilities, and you are desperate to learn if that facility has any cases or not. And if you have not heard from your facility, then that's not guaranteed, but pretty good news that they've not had a COVID positive. Again, we have around 30 long-term care facilities in Mobile County that we don't have any evidence of COVID positives. And the few that we do have are talking with their residents, communicating with their direct family members, and will continue to do that. And also try to reach out and provide other ways than in-person visits, since we're not able to do that. They're really working hard to try to provide other options for family visitation, like over Skype or providing iPads or telephones, those sorts of things. Sorry, I started reading again before I finished my sentence. Let's see. More questions about why we don't name facilities. I'll remind us to get a statement on that, Mark, so that we can release it. Are you testing all long-term care patients for COVID-19 in Mobile? This is not a yes or no answer. It's a case-by-case basis. So when we are alerted to a case of COVID-19 that is either a resident, a worker, or a visitor of a long-term care facility, we call them back. Remember, we've talked to everybody multiple times to make sure that they're preparing. But when we hear that they have a possible case, we contact them and we walk through with them whether they need to test all residents and healthcare workers or not. Sometimes it is yes, test all the residents of this unit, or test all the employees of that unit, or something of that nature. But it's not just an open and shut case. But we can do more testing now because the materials are more readily available. More labs are around to provide that testing. And so the good news is that we are able now to use testing, PCR testing, to help guide decisions about isolation and quarantine, and removing healthcare workers from the workplace who need to stay at home. Status of ventilator and beds for COVID patients. Last I heard, we were at maybe half our capacity for beds and ventilators at our local hospitals. Are you getting word that some hospitals are putting employees on furlough? If that's true, is now the time to be putting our healthcare workers on pause? I do not have daily contact with the hospitals. We had been hearing some rumors of that, just like you all had, and then we started trying to talk with them to work through that, and so far I don't know of a widespread issue of hospitals having to put workers on furlough. Again, please contact them directly to ask that question to our local hospitals. All right, and there were a couple things I answered yesterday really poorly, and I got an email that had much better answers, and so I'd like to provide them today if you'll give me a moment. So one of our viewers called to ask if Mchd or ADPH is requiring hotel motels to disinfect rooms. Here's the answer from ADPH. The hotel rules already require rooms to be cleaned and linens and towels to be laundered between guests. No additional recommendation have been issued specific for hotels, but standard protective procedures recommended by CDC should be used, including practicing social distancing and frequent hand washing. The second question was, why fast food and other restaurants don't require their employees to wear face masks or face coverings. It says they're wearing gloves, just no mask. So here is the answer. Please see CDC recommendations on wearing masks. At this time, there is nothing specific about food service or drive-thrus. Again, this were the responses from the state health department. In Mobile County, our health officer has issued a statement that he strongly recommends the use of face covering in all retail settings, and this would include restaurants and drive-thrus. So if you are a property or a retail owner or a restaurant or drive-thru owner, please consider providing face coverings for your staff, or encouraging their use, even if you can't provide them. But they can be homemade, they can be bandanas, or fashioned together with pieces of material and rubber bands, whatever you might be able to do. All right, I think this is the last one.
One about the zip codes.
The zip codes, okay.
What do we do?
Mark's reminding me to answer this one about the zip code. It says we're restricted. Let's see, let me get down here to the questions. Why are so many zip codes unknown? And what does the data tell us so far about people who've been infected? So many of the zip codes are unknown because, we're behind the 8 ball on the investigations. So we find out about a positive lab, and it on that live dashboard as soon as we know it. Then we have to go into the system and get that positive lab and pray that it has a phone number on it, that we can contact that person the same day. And that's not always the case. Particularly some of the drive-through clinics or the pop-up clinics that I've called them, they've not always been good about getting good, accurate address and telephone number on these folks. And so if we don't have that on the lab report, we have to go use some of our people finding services to try to get a good telephone number on them. And we're not always able to contact them the same day. And that's the reason that we have so many missing zip codes. What does the data tell us about the people who have been infected so far? So I don't have the daily report in front of me, so I'm going to be doing this from memory. But it tells us that it's mostly women, that it's mostly the 25 to 64 age group, but that a large, a large proportion, more than we would like, are over the age of 65, so it's around 22.5%. We know that African Americans are affected more than whites. It's disproportionate with our community. So we have more African Americans with disease and severe complications than we do at the population level in Mobile County. Also tells us that we are seeing the most cases in the areas of our county where we have the densest population. So if you look at the dark blue areas on that map, you see that that's where we have the most cases. And in the outer line zip codes, we don't see as many cases. People, live further apart, and often are not, they're not crowding their grocery stores and that sort of thing. So this is the kind of thing that we look at. Behind the scenes, I and other people are looking at things like, looking at characteristics of our hospitalized patients. Like, we know that if you're hospitalized and in an ICU and on a ventilator, that you will likely not have a good outcome. We know that most of our deaths have been in older people who have underlying medical conditions. And again, we keep saying these people need to stay at home. So these are the types of things that we learn. I also look at the cases that are reported each day to try to get an idea about if our cases are still continuing to climb exponentially. We had been doubling our caseload every 3-4 days, and it stretched out to every 5 or 6 days, and now it seems to be stabilizing that every 6 days we double our caseload. So we consider that when we're trying to think about things like lifting health orders. So these are the kinds of insights that we gain from the surveillance data, and the kinds of things that we talk about when we consider whether or not we're able to recommend lifting stay-at-home orders, curfews, face covering suggestions, those sorts of things. So, Mark, is there anything else? All right, I think that's it for today. I or someone from the Mobile County Health Department will be here on Monday at 2:30 to give you our weekly update. See you then.